Good afternoon, ladies and gentlemen, and welcome at European Policy Center. We're very happy to have you this afternoon for the last event of the Coalition for Health, Ethics and Society, supported by Johnson & Johnson. And for those of you that are following the EPC already for some time, you know that our council briefing about the presidency priorities is always the last event of the year. So also for this year, I think it's another interesting event. But while I was preparing for this event, I also realized that perhaps this one is even more important than the other ones that we had the last couple of years, because it clearly is an event where we're also going to take stock of health as a priority for the current mandate of the institutions. And especially due to COVID-19, but also due to the fact that already before COVID-19, the Commission had announced to plan to work on the pharmaceutical strategy and had announced and planned to focus on health much more perhaps than previous commissions ever did. I think this will be a really interesting stock-taking exercise where we will look at what the Spanish presidency has achieved so far and also what the incoming Belgian presidency will focus on. So my name is Elizabeth Kuiper. I'm Associate Director and Head of the Social Europe and Wellbeing Program at the European Policy Center. And I'm very happy to have two attachés with me this afternoon. So we have Enrique Terol for the Spanish presidency and Bjorn Gens, Attaché for Health and Pharma at the Belgian Permanent Representation. And when I was preparing, I was impressed by what the Spanish presidency has achieved. I know that indeed it has been called the Golden Presidency because of the fact that indeed it's the last presidency before the Belgian presidency takes over and with a focus on the preparations for the next mandate. So it's basically seen as the last chance to indeed finalize files. And indeed, you have been working very hard with council conclusions on mental health, the agreement on the structural fees to the EMA, the agreement on the regulation on substances of human origin, and also the agreement on the European health data space. At the same time, we also know that even though indeed the Belgian presidency has to deal with the preparations for the next mandate, you have quite an ambitious agenda, I must say. And last week, when I had your ambassador, Willem van der Voorde, at an EPC breakfast event, he indeed told me, Bjorn, that the Belgian presidency is really aiming to have a seamless transition towards the next mandate and also equally a thorough preparation to ensure that everything is in place for the discussions to come. So I think I'm going to ask both of you indeed how you see the mandate on health evolving and also the momentum for health. If you think that the urgency and the priority that was for health indeed will be maintained, and if indeed we will work also towards the next mandate with the knowledge that indeed health will be on the next agenda. So before we are going to do that, and before I give you the floor to say more about what you have achieved or what you hope to achieve, we will start with a video by the Coalition for Health, Ethics and Society, where we're going to take stock of the achievements under the current mandate, so that you have a brief overview with a few MEPs that indeed give their insights on what they think this period has achieved and what they hope indeed will come up for the agenda of the next mandate. So I believe that the video should start. Yes, there we go.
Owing to the impact of the COVID-19 pandemic, health has gained increased recognition at the EU level. The crisis has resulted in an elevation of EU health significance. This has resulted in increased cooperation between the EU and its member states, the creation of a European Health Union, and unprecedented budgetary allocation for the EU for Health programme. But what do MEPs see as the greatest achievement for the European Parliament with regards to health?
Multiple areas have been moving in the positive way. You see, prior to COVID-19, 84 million people were impacted by mental health challenges. Now mental health is very much at the discussion table. The work that's being done on cancer and the EU-wide cancer plan that's there in order for us to grow a healthy European base. And then finally, the COVID-19 pandemic. Countries right across the 27 member states had access to vaccines, PPE gear, real information in real time.
After the COVID, we could establish the SANT committee. This is the first time when we have official committee to support the European Health Union.
I would also say the coming out of the pharma package in order to guarantee better access and affordability for medicines, for treatment, for citizens all over Europe.
We have all learned during COVID-19 about the importance of health, but we also have seen that very easily at political level, other topics take over. So I do hope that the European Parliament, and especially the Sant Committee in the European Parliament, will maintain the momentum also during the next mandate.
Well, that was very much the perspective from the side of the European Parliament, but equally, indeed, at European Council and Council Working Party level, a lot has been achieved. And over the past couple of years, especially since COVID-19 started in 2020, a lot of working parties indeed have been dedicated to the importance of health. So with that, Enrique, I'm very interested to turn to you. You have the floor for a presentation of what the Spanish presidency has achieved. And ladies and gentlemen, just in terms to provide you with a running order, after Enrique's presentation, we have Bjorn from the side of the Belgian presidency. And then, of course, and that's probably the moment that you're eagerly awaiting, we have time for questions and answers with the two attachés. So with that, Enrique, I'm happy to give the floor to you. I believe, Enrique, you're still muted.
Okay, can you hear me now? Okay, perfect.
Yes, absolutely. We can hear and see also your presentation very well.
Excellent. So thank you very much for inviting me to share these minutes with you. Actually, what you said, you were completely right. It has been an exciting time, no? After the COVID, and with all the different dossiers and initiatives that were on the plate during the last 2 years, and that we have been trying to complete. As presidency, as you know, that's the traditional way of working. We have two main elements for establishing the priorities. The regulatory priorities, which is what we are doing here in Brussels, and the political priorities, which are at the general approach of each presidency to strengthen or to impulse certain elements on public health, healthcare, etc., etc. So on political priorities, we had several priorities organized in three main groups: prevention and healthy lifestyles, where we were addressing childhood obesity, healthy cities, vaccination, chronicity, response to addictions. Then we have strengthening the capacity of health systems, where we were addressing digital health, the One Health element that was, as you explained, Elizabeth, before, a main element related with the experience of the COVID pandemic. And we included also our overall priority of the Spanish presidency, but with a focus in health, which is called the Open Strategic Autonomy. And then we also developed many conferences related with other health strategies that for Spain were clear priorities, which was HIV and associated stigma, mental health, cancer, rare disease and European reference networks, and organ donation and so on. I have marked in red those priorities that are also related with regulatory initiatives that we have been working on during the presidency. What are the legislative actions we have been working on? As you mentioned, there are many elements that were coming from the past. First of all, we had the EMA regulation. We were able, after the Swedish colleagues, they had the general approach in their presidency, we were able to finalize in a really speed way in around 3 weeks the agreement with the European Parliament in September. Then we had the very complex file. Sorry?
I'm very sorry to interrupt, but I don't think that your slides are moving. At least when I look at your slide, I still see the opening slide. And I believe you have other slides that go with the message.
Yes, but I don't know how to manage that, because for me, it's okay.
Now I see legislative actions. So I believe.
Okay, can you see that now?
Yeah, I can now see, I think it's slide 4, legislative actions.
Yes. But can you see that there are appearing different things in the slide or not?
Yeah, the text boxes about first reading and council negotiations.
Yes, exactly.
Appear for me in the box, yeah.
Okay, perfect. Then it's working now. And then on European Health Data Space, a very complex file. We have been negotiating that during our presidency, and we have been able, thanks to the real very good collaboration with all the member states and the Commission, we had the negotiation mandate, and we were able to have actually the first trialogue just last week, the 14th of December, one day after the Parliament voted in plenary their opinion. Now the colleagues, the Belgian colleagues, Bjorn and his colleagues, they will have a really very tight time to agree with the Parliament to finalize that. We will support them as much as possible. And we have also the SOHO regulation, which we also closed that in first reading agreement last week on the 14th of December. And then we have the pharmaceutical package. We were not only able to have a presentation on the impact assessment of this file because we were so busy with the other files, it was completely impossible to address more elements there. And we have been working also in three multilateral and non-legislative initiatives, one on the Treaty of Pandemics, the COP10 on tobacco, and the Council conclusions on mental health. On the COP10 tobacco, as you probably know, that was cancelled, the meeting that we had foreseen in November, and now the Belgian colleagues, they will have to organize that in the EU position in January. And on the preparation of the Treaty of Pandemics, we have been working hard. It's a difficult file. Later in the EPSCO outcomes, I will mention a couple of things. And on the conclusion, Council conclusion on mental health, that has been really a central priority of the presidency, and we are very happy to have adopted these conclusions in the public health working group, but also other three sectorial conclusions on mental health, on addictions and mental health, on precarious work and mental health, and on youth and mental health. And that has been the basic elements. I can explain just in a few minutes about the presidency. We have been working very hard with the Working Party of Public Health. We have around 42 meetings of the Working Party. And we have, of course, many different meetings, bilaterals, expert meetings. Have been a very, very, very busy time. But I would say that for us, it has been really an honor, and we are very happy about the outcomes. And then let me give you some overview of the EPSCO Council meeting we had on the 30th of November, just 14 days ago, who was chaired actually by my new minister. She was nominated a couple of weeks before. That was also for us during the presidency. We have a complex political situation with with two elections, the change of ministers, etc., etc. But we were able to overcome the situation. And in the EPSCO, what we did, we had
Enrique?
Yes.
Because I see that in the chat, people are indeed saying that the slides are not moving, and I believe you have slides on the EPSCO, slides 6 and 7.
Can you see it now? This is the initial EPSCO slide.
No, we're still looking at the which is slide 4, legislative actions.
Okay, then
yeah,
I will
but now it says
again.
so. Perhaps when you speak, yeah.
Okay, now you can see the EPSCO Council slide.
Yeah. Now we see slide 6.
Okay, then one element. Now it's changing the slides now. Open strategic autonomy. Can you see the slide?
No, we now still see the previous one about the EPSCO Council, which is chaired by the minister and.
I don't know, a mystery.
Yeah. Now we see open strategic autonomy.
Okay, I will put that in this, not in showing the presentation, because it seems something it's not working.
And probably you need to move it manually. So
yeah, I will do that. So then we have a political debate on one element that has been related also with the pandemic and with all the consequences of the pandemic, which was open strategic autonomy in health. That was a overall priority of the Spanish presidency with different focus, but we focus, of course, on health element. And here we have an exchange of views of the ministers on the consequences on not having at European level a complete autonomy to address the production of medicaments, medical devices in particular, medicaments and medical devices, but also other elements that are related with other areas like workforce or like skills. So then what it's clear in this discussion came that all ministers were really very interested on this element, how to deal with this, if that will imply changing the approach to the production of the medicaments. And we have been working also looking at the Commission communication on addressing medicine shortages in the European Union, and to the first list of critical medicines that were produced, and it's now updated by the medicament agencies, by EMA. So this element, it's fundamental. It's related also with the pharmaceutical package. And I will say that will still need to be reflected. And I am sure that my Belgian colleagues, they will follow this element, because we will need to pass from the reflection process of the identification of the problems to the actions. And that will imply different actions by the Commission, but also by the member states to to ensure their autonomy and to avoid having shortages as we had 2 years ago of very basic medicaments. So after this element, we have the Council conclusion on mental health, as you also highlighted in your video. I mean, mental health has been one element that has been coming back in all the dimensions of society, not only from the public health or health care perspective, by all the different sectors at work level, at education level, at environmental level, at all possible levels. And now it's high in the agenda. We have included in these conclusions all the possible actions to be addressed. One main conclusion is that all member states, but also at the European Union level, should develop an action plan or a strategy on mental health that should be monitored, which is the fundamental element. Not to have just a nice document of council conclusions, but to really be followed by a strategy that could be monitored to identify if we are able or not to tackle with the challenges we are having in this area. So as in all the EPSCO Council, we had an overview. I am not going to enter into that, of the legislative files that we were discussing. On the 30th of November, actually the only regulation that was already approved was the EMAFIS regulation, and now we have been able to have the mandate or even the finalization of SOHO and the start of the trilogues with the European Health Data Space. So the other elements we have been mentioning were also addressed in the EPSCO Council, especially the International Pandemic Treaty, which is a complicated element for the discussion. As you know, we are here presenting the position of the European Union as an integrated body, not the individual position of the member states. That, of course, is always a challenge. We have been working all together and trying to fine-tune the different elements that were coming from the discussion. So the European Union probably is having a position that it's not shared by all continents, by all geographical areas. That comes, and its logic, from the high level of development of the European Union. As just to put as an example for us, for example, One Health and antimicrobial resistance in all the domains, veterinary domain, environmental domain, health domain, it's a priority for many countries, especially in the south of the world. They can address some of the elements, but for them it's really a challenge to address all possible dimensions related with that. So we are in this discussion. The Belgian colleagues will follow with this discussion to maintain and to put high in the agenda the European Union position on that for the to be able to have a common agreement on June 2024 during the Belgian presidency. And then we have also, which is other element, but was especially interesting in this EPSCO, we have the AOB's topic, and several member states were presenting, supported by all other member states, 5 elements that were really attractive. One is the collaboration and exchange of views on the long COVID situation, which is a challenge coming from the pandemic, and it's still under analysis with no clear diagnosis criteria, with no clear treatment approach, etc. The health and climate change that has been also addressed by the European Union, not only at local level, but also by signing the declaration for the COP28. That was also one of the elements during our presidency. We were able to finalize. And then we have a discussion on the implementation of medical device regulation and the in vitro diagnostic medical device regulation. As you know, that it's an issue that it's coming back, and it's based on the difficulty to really update and to reassess all the medical devices and the medical diagnostic medical devices in time, to be assured to be put in the market. Then we also address the state of play of one really very important initiative, 1 million genomes, which is also related with the European health data space. We have been discussing that as one of the elements, as a very concrete case on how to exchange secondary data to improve the research and the evidence for development of new medicaments, or to identify better the diseases of genetic origin. And also we have, and probably my colleague Bjorn could mention that, a proposal coming from the Belgian presidency on a common approach and organization of medical evacuations of wounded citizens from Gaza, which was supported by all member states. And it's, as you know very well from the current situation, a real worldwide priority now on how to help the citizens in the street of Gaza. As just to finalize, during the EPSCO, it's normal that the presidency is presenting an overview of their conferences, and in also the Belgian colleagues presented in a non-public session their priorities, and we have a working lunch, not public, on one of the priorities of the Spanish presidency, which was on the comprehensive approach to tackling child obesity across Europe. Here, the request also from all member states to the Commission and to the European Union institution is to continue in this approach, which is a real, very important public health problem that now we think it's a bit unclear what we are doing as European Union community to tackle this problem. And that's it all from my side. So thank you very much for your attention.
Well, thank you so much, Enrique, for the overview of what you have achieved. And I must say, congratulations for everything that you've done in just 6 months. And I think before going to Bjorn to hear what you're planning for, I think I have one question to you, because in your presentation, it was very clear indeed that the Spanish presidency has been working on health beyond public health, because you spoke about the nexus between health and climate change, health and well-being with a focus on mental health. And also in the Granada declaration, I think it was the Spanish presidency who was very clear about the importance of health in comparison, for example, to energy, tech, and digital, being seen as 4 very strategic sectors for Europe. And I think my question to you would be that, given sometimes public health and also the EPSCO Council is being seen as a rather technical area, do you feel that the momentum for health and also the link between the EPSCO Council and other councils will remain stronger also during the next mandate?
I would say that that's our wish. I mean, I think that it's a wish shared by all member states in the area of health. Let's see, because, I mean, for me, you know, it was a bit of a surprise that in the last speech of the President of the European Union, the term health was mentioned just once, and in middle of many other priorities. So I think that probably people is fatigued. It's about the pandemic, about this threat. People likes to forget about that, but we precisely because this problem was having so huge impact, we should not do that. And then I think that with the work of the Belgian colleagues and using also all the lessons learned, we should try to define a priority plan for the European Union on health, because public health, the traditional public health approach has been changed. So we are having a One Health approach. So as it was called before, health in all policies, now One Health, but at the end, what is clear is that the determinants of health or the impact on health of the rest of the sectors, it's fundamental. It's a key element.
Well, thanks for that indeed. And I'm sure indeed that the Belgian presidency will continue working on that hope that indeed that will also then materialize during the next mandate. So with that, Bjorn, we're very keen to hear indeed what you have to present for the next 6 months for the Belgian presidency.
Well, thank you for the floor. In comparison to my Spanish colleague, I will start with a blank slate. We still have 6 months to fill. But first and foremost, I would like to thank the Spanish colleague. It can be said enough that they have achieved remarkable results. So on the legislative files, but also they managed to keep also very important political priorities on the agenda, just like mental health. And it's really up to us now to live up to this same ambition. When we started thinking about our presidency 1 year ago, we were a bit thinking about, okay, in which political context do we live in today? We have lived a global pandemic. We could not imagine this legislation, which of course resulted in many suffering and losses, but also resulted in an ambitious launch of a European Health Union, which is yet to be fulfilled. So from this perspective, we were thinking about health as a priority, but as it sometimes go, health as a priority remains a bit, not sure after a pandemic. So I think the biggest challenge now is to keep it on the agenda, and so that's why we were thinking a bit, okay, but what do people expect from policymakers, civil society, and industry as a whole? And that's why we came up with our slogan, a European Union that cares, prepares, and protects. Because care in a broad sense is, of course, is about caring about real problems, real issues. But also in a more narrow sense, well, we should reflect on care on the national level. We have many health workforce availability problems, but we cannot address them solely on the national level. Then this prepares, of course, preparedness that goes with preparing and being able to respond to the next big crisis. And I think today is the moment we should learn from the previous crisis. But what is needed, and is there still a political will to address all these issues? And then, of course, protects. We're living in very volatile times. I heard Elizabeth mentioning the question, do we have this broad view on other filières? I think this is, the answer has to be yes. Belgium proposed almost 1 year ago in a non-paper to open the discussions on the Critical Medicines Act. Well, this has many industrial implications, but if we talk about health workforce, this is mainly about internal markets. So these are all problems we really want to address during our presidency. So that brings us to the 3 pillars of our presidency. A European Union that cares. Well, first and foremost, we want to address health workforce, of course. That goes with skills, that goes with availability, but we are very well aware that we will not solve this problem on the national level. So we want to open the discussions on the legislative framework. For example, let's have a discussion on the qualifications directive, but it goes broader than that. We also want to address the switch from a supply-driven system when it comes to health to a needs-driven system. What do we need to develop a common methodology to identify unmet medical needs and to steer research and development? Then also when it comes to non-communicable diseases, I think this commission already has put a lot of effort in the European Beating Cancer Plan, but I think we need more, and we need a stock taking, what is yet to be implemented. And of course, we will have during our presidency also the opening and the finishing of the negotiations on the prevention package. You have the Council recommendation on smoke-free environments, and you have the Council recommendation on cancer preventive vaccines, which focuses on an increase of uptake of vaccinations, but also on the monitoring of it. Then a European Union that prepares. Well, I also already mentioned it, but 1 or 2 years after the heat of the pandemic, I think it's time to have, before this legislation ends, to have a stock-taking exercise on our health emergency framework. And we have many questions to do that. What are our financial means? How can we use them in a way that they respond in a sufficiently manner towards the problems we will have to face? We also have many new institutions, or some institutions on the European level are a bit enlarged. So how can we have a good cooperation between them? What will be, how can we develop a multi-level response strategy for the future pandemic? And also the question, does the health emergency framework has to remain its focus solely on pandemics, or can we also think a bit larger? Think of the AOP that Enrique also mentioned on climate and health. I think this question and this topic will only evolve in the next few years. But of course, preparedness is bigger than only pandemics. We saw during the pandemic that, and I think the WHO recorded this, that there were over 18,000 COVID clinical trials, but of which a vast majority, I think 95%, were useless, basically. So here is a bit the question: should we open the discussion to have a strengthening of European ecosystem of clinical trials? Should we upscale the European capacity of clinical trials? I think this is a very important question to address in conferences, but also in council conclusions, and to think about this together with the member states, the institutions, and the civil society. Then, talking about clinical trials, I think we should mention that the elephant in the room, the silent elephant in the room, antimicrobial resistance. Under our Swedish colleagues last year, we had the Council recommendation on AMR, but we cannot rest and we cannot wait until all the benchmarks in 2030 have been reached or haven't. So I think it's also time to already have a stock-taking exercise on the implementation, on the governance, and the European governance on AMR, and we really want to open once again this discussion, because we remain very concerned on this evolution. Then last but not least, a European Union that protects. I think in many headlines last month, the Belgian proposal on the Critical Medicines Act was very present. But to be honest, the proposal and the non-paper of Belgium, which was supported by 22 member states, was compiled out of 3 pillars, of which meanwhile 2 already have been reached, and a third is in the pipeline in the near future. So the first one was to have a European list on critical medicines, to have a monitoring of the supply chain, the production chain, and I think ECDC has published this list last month. Then the solidarity mechanism, which is also in the upscaling and in the opening phase to open it. Where can member states help each other when there are sincere and shortages now? This is also something where member states and European institutions are helping each other very actively. And at the third, we had the communication on security of medicine supplies last month, or in October, sorry, already 2 months ago. Wow, time is going fast. Where we will be, during our presidency, accommodating the development of a critical medicines alliance, where we have industry, public officials, and civil society together to already have a reflection on the future of these critical medicines. What is needed to address these very problematic shortages sometimes, and what is needed to have maybe the production of critical pharmaceutical products, and once again in Europe. So these are a few of the discussions we want to open. And of course, it remains to be seen when it is published, but I think it would also be wise from a European perspective to talk about a stockpiling strategy. This is certainly something that fits in this third pillar of the Belgian presidency. So when we these are the thematic policy priorities of the Belgian presidency. I already addressed many of the legislative and the non-legislative files. Maybe I will just address them shortly before we have a Q&A. The next 2 months will be very, very busy for the Belgian presidency, of course, with help from our Spanish and other colleagues. But we currently have trilogues. Luckily, the Spanish colleagues managed last week to reach a political agreement on the trilogue of substances of human origin, and which is very important for national health systems. But I'm not sure if it's already the whole health society is already aware of this. But European Health Data Space, what a project! We'll start trilogues very shortly. Last week in Strasbourg was the very first one, the political handshake to open it. We have a real, but still not a sure opportunity to conclude this file, but we're fully going for it. And thanks to the Spanish presidency, really have the chance to do it. And I really think the time is now to really launch the European Health Data Space. Because why? Well, we have now maybe a few weeks, maybe 2 months left to conclude this file, together with the European Parliament, which addresses patients' needs, but also health system needs. And it is important to reach it. Why? Because if we do not reach an agreement now, then when will we? All health systems are ready with their digital infrastructure to launch their own national infrastructure and to collect data for a better health policy. Well, I don't think we can miss this opportunity to have a convergent European health infrastructure on data. So we're fully going for it. But of course, there remain many issues that we have to solve during trilogues. Then, of course, the big elephant in the room, I was talking about silent elephant, AMR, but the big elephant in the room is the pharma package. The whole industry, the whole civil society, patient organizations, and of course, national health systems are looking already 1 year forward to it. But of course, in the council, it takes a while to translate such a big file and to start the negotiations within the council to have a point of view. So we had, of course, time with the Belgian presidency, the Spanish, of course, already maybe the Hungarian. We also have reflections within the trio. How should we approach the pharma package the best? You have always two different kinds of approaches when it comes to filing in the council. You can start from Article 1 and just go downwards chronologically. This is what Belgium not will do. I don't think we have time to waste. So we decided to really put full our efforts and our energy in the political priorities and the most maybe divisive, but also most important issues. And that is, of course, first, shortages, and second, very political incentives. So this is how we will approach the pharma package as a whole. And the idea is that we will, in 6 months, that of course we will not reach a general approach, but we really want to have a real, I would say a first, but especially a real compromise among member states on those two very important policy priorities within the pharma package. So this is our endeavor, and I think we will do it. Then, of course, we also have non-legislative files. Thanks to the unrest in Panama, we will have to go to Panama in February for the COP10 tobacco control. Thanks to the Spanish colleagues, we already have the European position, so we just have to be there and present and make sure that the European coordination runs smoothly. But we are open for it, and we are ready for it. Then Enrique mentioned also that this is not an easy file, the pandemic treaty and the international health regulations negotiations. We, as also did Spain and previous presidencies, we will also have strategic special committees in Brussels, in the Council, and I think that they will become more important as the end of the negotiations reaches now. But of course, this is a file that not only concerns the EU, it's about the world. It's a global negotiation. So I think it's my honest opinion that at the end we will have also in the EU a big discussion on where we'll have to land. We'll have to talk about financing and just also check what the global south will need. But if we really want to reach an agreement, we will have to face these issues, and we will have to at the end go agree on them. Then I mentioned the pharma package, the prevention package, the Council recommendations on vaccine preventable cancers and smoke-free environments, and then I think maybe the mascot of our presidency, but it's really an important document for the next mandate, the Council conclusions on the future European Health Union. This is something that was developing the last few months within our Belgian minds, and first we want to have two different Council conclusions on two topics, but as time went on, we realized that we have an opportunity that we cannot miss during our presidency. We will have the new incoming commission after our 6 months. So we decided to have a broad, but a very concisive, but a broad Council conclusions on the real health priorities, on the real issues we are all our governments and patients are facing now. So this will be on. I already mentioned the themes in my discussion on the three pillars of our presidency. The idea is to have at the end real conclusions that are a bit reflection of the discussions we had in all our high-level conferences, AMR, but also the health workforce, security of medicine supplies. All these thematic priorities will pass by in these Council conclusions, and it is the idea that we really give a mandate to the Commission, but also clear with a clear demand to put it once again high on the political agenda, especially after the pandemic. So this is our aim. So thank you for listening. I hope this has a bit concealed the ambition of the Belgian presidency, but I'm open to have a short discussion with you and to answer any question.
Well, thank you so much indeed, Bjorn, for the presentation of your priorities, and also indeed to the commitment of the Belgian presidency to continue reflecting on the future of health, also the definition of the European Health Union, because as you said, it's not an achievement that is set in stone. It needs to evolve. So I think especially link it to other areas that are of importance for health. I think I have one question to you before we open up the floor, and I see that we're already getting some questions in. Can I just remind you that it would be helpful to mention to which of the attachés you would like to ask your question? So is it a question reflecting on the Spanish presidency, or is it more forward-looking to Belgian presidency, so that we know whether either Enrique or Bjorn is going to tackle the question? But perhaps, Bjorn, one question, because Enrique mentioned also the commitment of the Spanish presidency to HIV and tackling stigma. At the European Policy Center some time ago, we have indeed published a report about the importance of working and keep working on HIV, also in light of the Sustainable Development Goals and the importance of eradicating HIV by 2030. I haven't heard it in your list of presentation. Is this something that the Belgian presidency will continue, or what kind of action is required, you think, that indeed we continue also there the work done by the Spanish presidency?
Yeah, of course. Thanks for the question. It's a very important question. Well, there are many things, of course, I didn't address, but HIV remains a political priority for the Belgian presidency. I think this is also a topic that really deserves a place in the Council conclusions on the future European Health Union. I think this is also the right place to address this topic. So you can be assured that it is also very high on the Belgian agenda.
Well, that's very good to know, Bjorn. Thank you so much for that. So let me then indeed go to the questions. And again, for those of you that haven't posted your questions yet, please either post them in a Q&A, or if you want to speak, I mean, that's very fine as well. Just raise your hand and we'll make sure that you get the camera and the floor. So let me see. I start with a question from Cristiana Montero, where she says that a significant issue is the lack of comparable skills and degrees across Europe. Indeed, it's very true, and I think something that also we have witnessed during COVID-19, that the vast number of professionals in diagnostic in countries such as Portugal, Italy, and the UK have no equivalent across Europe, where those skill sets are absorbed by doctors, owing a monopoly of skills and severely impairing our resilience. That's absolutely, I think it's perhaps more a statement than a question. I don't know whether any of you would like to hint on this, because I think it also links to perhaps what has been said about the professional qualifications directive.
Exactly. Yeah. If I may. So I did not mention it, I think, literally, but at the end, it will be the ambition of the Belgian presidency to have the aim to develop a health workforce strategy, and to invite the European Commission to do this. I mentioned, of course, the professional qualifications directive, but there are many other directive that also addresses these problems. So we will want to have a real in-depth assessment of the legislative framework, because it is about recruitment and training, having professional development, skill mix, retraining. It's also about common. But the main effort of the Belgian presidency when it comes to health workforce is to have common goals, targets, monitoring, good practices, all these kind of things. But that's why we need. We cannot do this only within the Health Council, within the Health Working Party. We really have to think. We have. I think we have to open the filières, but we also have to invite them to think about it. That's why we really want to address this is within the Health Council, but we cannot expect from our friends from Campus Council or Internal Market Council that they will open the debate on health workforce in this specific matters. So this is what we want to do, to open this discussion and to have at the end a real result in the next Commission.
Yes, I think as you say, I think that's always the question, how to position the EPSCO Council vis-a-vis the other councils. And I think in the context of the European semester, a lot of effort have been made. And I think also there the Belgian presidency is very keen to continue these. So that's very important indeed. And Bjorn, I believe that indeed quite some questions are directed to you, because I'm going to bundle a few of them. Flaminia Machia asks, is there a specific plan for rare diseases? And perhaps we can also take the question from Stefan Joris. So Stefan, it's also good to have you. You're asking, is there a project for joint price negotiations for orphan drugs on EU level? Because indeed we have seen, and that's also a comment that Stefan makes, we have seen with COVID vaccines that indeed joint procurement has worked out. And it would indeed speed up access for patients, but it also at the same time may make it more accessible and affordable. So indeed, is there any specific focus on rare diseases? And if so, and in parallel, will there also be perhaps a discussion around joint price negotiations?
I will have a short answer because I have not all answers in my pocket, but I will also leave the room to Enrique. Maybe he can add up to it. But when I said that we want to open the incentives discussion within the pharma package, I think this addresses exactly what the audience is asking when it comes to rare diseases, etc. Because we really want to open this discussion on and I think also Commissioner Margarita Chinas already said it in the proposal of the pharma package. We want to. I think we will have to open the discussion, or do we want to have one fits for all mechanism for diseases combining pharma, or should we have a discussion on how to address rare diseases to orphans, and how can we do it? Because our national health systems are waiting on this. For example, you have the proposal of a voucher when it comes to EMR voucher in the pharma package. a real discussion will be like, is this the way we have to move forward? And if not, what else do we have to steer research and development towards real needs-driven thinking? But it's not so easy to have this, and this will have to be a gradual conversation among member states, but also among public policy and the industry, because there are many things at stake. But I think that Enrique maybe can be complementary.
Thank you, Bjorn. Just on the question of Flaminia, on rare diseases. I mean, I mentioned that very quick in my presentation, that rare diseases and European reference networks, that was one of the main priorities in our presidency, and actually we organized a huge conference in collaboration with the Social and Economic Committee in Bilbao in October. We had more than 600 attendees there. And now the Social and Economic Committee, they are working, and I am working with them to issue some kind of conclusions on this conference that will be distributed. And one of the main conclusions on that is that we need to we have to put again rare diseases on the agenda of the European Union, not only as instrumental elements, which are very important, are fundamental, like European reference networks or the pharma legislation, but as strategy. So the Commission did an excellent job during many years, but unfortunately, since 2017, the rare diseases has been put only under the research agenda or under the instrumental tools, but not as a strategy. So that will be our request. And I think that's related with many things that are ongoing. For example, for the e-health data space regulation, rare diseases is the perfect case of study. So why we are doing that in the health data set, precisely for rare diseases, we will have the economy of scale first for secondary use to reach conclusions on the epidemiology, the possible new treatment, but also we can have the primary use. So each patient with rare disease will have the capacity when visiting other doctors across Europe to have all their health data accessible, and they can share that with any type of doctor or healthcare provider in the European Union. So we don't know if the Commission will get this call for the new working plan. We will propose also, of course, in this discussion with the Belgian colleagues to put that under the list of, let's say, homework, no, Bjorn, for the next European Commission.
It's well noted, thanks.
The next question is about a European health data space. Sarah Cullen asked actually both of you, so perhaps both of you a quick answer. About the European Health Data Space regulation. What do you think are the most critical issues in the trilogue with the European Parliament when it comes to secondary use? And I think, Sarah, that's a very good topic indeed. So both of you, what do you think about secondary use? How will it come up in the trilogues of the Parliament?
I will leave the floor now to Enrique first.
So I would say that very shortly, opt-in, opt-out. That will be the discussion. So while the Council common approach has been to have the capacity at member state level to decide on that, some member states may put an opt-out clause or even an opt-in. I would say that most of the member states, they don't want this, because the problem that we will have unbias of the data sets for research, for evidence, looking for evidence, etc. That will be one of the main elements, because Parliament is asking for having a harmonized opt-out for all member states in the European Union. And the second thing that we are not so far, I don't know, John, what do you think will be on the localization, data localization in the European Union? For in the Council text, we put that as the rule, but also with some exceptions, because there are some specific elements to take in account. Could not be considered as a general rule of all the cases. We have, for example, the case of North Ireland, the case of even in the case of Denmark with the Faroe Islands or Greenland. We have also all the trade and the GATS agreements that could be related with it. So That will be, I would say, the two main elements. And also, I think that on third countries' involvement, reciprocity, that will not be a problem, but let's see. No, Bjorn will tell us what the Parliament writes on that.
Yeah, well, I think Enrique has summed it up, the three priorities. I think when it comes to opt-in, opt-out, I think this is the main question of this European health data space, because at the one hand, you have, of course, patients' rights to have control their own data, but at the other hand, and I think this is also a very important interest of European health data space, how far can we go and how far can we use data to have the health policy of the future and to have more answers to diseases we don't have now and to help us more people. So I think this is the trade-off here in the European health data space. And I think both are even important. But of course, we will at the end we will have to have a balance, strike a balance between those two. And on the second thing, data localization, I'm not speaking for the European Parliament. I will not make that mistake. But I understood that they also, of course, want to have data localization within Europe. I think this will also be something to sort out with the Commission at the end, because, of course, we have the aim to have our data within Europe, but at the other hand, there is a Commission that says, but we have international agreements. So we will have to have a good answer to this within legal framework.
I'm conscious of time, and I can only imagine you must be very busy. So to try to be a strict timekeeper. But perhaps the two last questions. We have one question from Cesar Lerker about long COVID. And indeed, that's a topic where also at the European Policy Center a few weeks ago, we had a workshop because this impacts 36 million of Europeans. And it's true that even though there have been a few attempts also by the Commission's expert panel to address the issue, the question from Cesar is the Belgian presidency also going to dedicate part of your job on it? And I think the second question to you, Bjorn, is from an anonymous attendee. How will the Belgian presidency involve the industry in the Critical Medicines Alliance? So again, very different questions, but one is on long COVID and the other about industry involvement in the Critical Medicines Alliance.
Well, I will first answer the second question and then you can repeat the first one. Yeah, on the Critical Medicines Alliance, to be very honest with you, there are still talks ongoing between Council, Commission, and Comitology, and so it is not clear, but it will. First, the aim was to have like a start in January of this Critical Medicines Alliance. It's already now clear to me. I think it will be more towards March, April, to have a real idea of this development. But I think that the honest answer for now is that is yet to be seen. But the idea is, and if you read the communication very carefully, is that there will be an impact assessment, and very often in European legislation, is an impact assessment, a preparation for regulation. So, and then if you read the Belgian proposal in the non-paper very carefully, we still aim for we still aimed for to have this regulation. But of course, we will have, and I think a bit that the alliance will be the place where we have to think about the advantages and the disadvantages for this trajectory going towards this direction.
Well, the second question, I think the answer can perhaps be brief because probably it's a yes or a no, but it's about long COVID and to what extent indeed the Belgian presidency will focus on this. And I don't know, perhaps maybe in the council conclusions that you plan that, because long COVID is not probably an individual priority, but will you dedicate any?
Yeah, the thing is, I could make it easy and say that we will just take it up on in the council conclusions. But the idea is to have overarching things in the council conclusions, and long COVID could be a part of it, but then in different subsections, for example. Because I think, if I'm not mistaken, long COVID was already addressed very well during the EPSCO Council, during informal councils. Of course, we will follow up on this, but I think now it's also time to have real answers to real problems, and we will do as much as possible to accommodate this. But we'll not have, for example, a conference on long COVID, but of course it can be addressed in many conferences and discussions that will go ahead.
And I think everyone realizes that you already have a quite ambitious agenda for basically the 3 months that you have. And of course, then the other 3 months probably will be dedicated to the preparation of the strategic agenda and indeed the seamless transition. So I think that that's very understandable. And I think that brings us at the end of this hour. I mean, there are still questions to you, and I think we could have gone on longer. It's always a really interesting event, I personally also find. But Enrique and Bjorn, many, many thanks to both of you. I think that was very enlightening. Also, I think it's very encouraging to see that indeed both the Spanish presidency as well as the incoming Belgian presidency really continue working on health and ensuring that there is this link between health and other priority areas. I think, if anything, the stakeholders in the Brussels community and beyond have learned is that that is very important for indeed health to remain on the agenda also of the heads of state and the broader, I think, geopolitical context, as you also both showed in your presentations. So with that, I really would like to thank you very much. I hope to see more of you in the months to come. And for those of you that have been listening in this afternoon, please do follow us also next year, because next year will be a very important year for the Coalitions for Health, Ethics and Society. We're planning a really interesting program with more events, more topics, more workshops. So in case you're not yet registered for our newsletter, go to our website, epsc.eu, and register so that we also see you back next year. So many, many thanks again. I hope you all have a relaxing break and stay in touch.
Thank you very much.
Thank you.
Thank you. Bye-bye.